Welcome, everybody. My name is Suzanne Paulson. I'm the CEO and the founder of IECO, and this is our third episode of the regional series, Elite Award winner series of helping you guys out there find great dry eye doctors. And I'm so excited for tonight's presentation. You're going to meet the wonderful Dr. Nathalie Cassis. And before we get started, I'm just going to, as I have for the last two episodes, acknowledge kind of how we got here and what this is all about. And that is the initiative to take what we've been doing on a national platform, an educational platform about dry eye, and really extending it out so that we've had so many people asking, well, how do I find great dry eye doctors in my area? And this is why we're doing this whole series. So I thank you to a big thanks to our big panel that have been with us for 6 months, and we're going to continue with the panel in September, the end of September, more on that later. But really we're excited because this whole thing has just evolved into something so much bigger than us, and we're so happy that you guys are all finding it very, very informational and beneficial. With that, I am really pleased to introduce Dr. Nathalie Cassis. And for those of you who have joined us in the past, you know what we do, these live Q&As at the end. And if you're new to this platform, there's a chat section in the bottom or the top, depending if you're a mobile device or on a desktop. And feel free to put questions in there throughout the presentation, Dr. Cassis's presentation. And at the end, we'll answer those questions as best we can. We'll reserve at least 9 minutes at the end, and you can have some active Q&A. Dr. Cassis, welcome.
Thank you for having me.
I'm so excited you're here. And you're in, I am pronouncing this correctly, right? Is it Norfolk?
Yeah, Norfolk.
Norfolk, Virginia. Yes. And that is, I'm imagining, a pretty warm place this time of the year, huh?
It sure is, yes. That's why I have to turn on the AC, because it gets a little hot. Yep.
We are too. We're in the desert here in Temecula, California, so we have the dry heat. You have a little bit more humidity than we do over there, I think. Yeah. But I know that you did this lovely trailer. If those of you out there didn't have a chance to see it, it would be, I think it's worthwhile. Maybe you can just share with the audience a little bit, like where in your career was it that you discovered that dry eye was something that really, really needed to be addressed in your practice?
So what I think I mentioned in the video is that I've been practicing. I actually graduated in 1992. So it's 29 years, which, whew, that's a long time. And before coming to Ghent, I've been in Ghent for about 2 years now. I was in Newport News for 17 years. And I saw a lot of dry eyes, but I didn't have the time or the equipment to really address it and understand it. And so I would do like so many and just give patients artificial tears or do the old baby shampoo routine to help with their lids. And really, although it was devastating for COVID to hit after I've been here for just a couple months full time. So I came here full time in January of 2020. COVID hit in March. And in that downtime, because it is really such a complicated topic, dry eye and ocular surface, that I used those 10 weeks where we didn't see patients and really focused and increased my understanding and took a big leap of faith and spend money when no money was coming in to buy equipment and get myself educated and really understand better the patient that comes in with a variety of complaints that relate to dry eye, which I might have not known previously, and just really increase the scope of my practice and what I can do for my patients. So I've known about it for a long time, but really having that time, that couple months to really dedicate myself and learn a lot more about it took me to the next level. So it was a COVID gift, really.
Wonderful. That's wonderful. That's a silver lining indeed.
It
and
really
especially
was.
Now it's with all the different options in technology and science, the evolution of the science, it was actually is perfect because I think it really required that 10 weeks probably to dig
Yes.
into it and understand the differences and your options and what would work best for you. And I know we're going to get into some really great things with your case studies, which I'm excited for you to share. When in your practice, what percentage of patients do you feel are moderate to severe dry eye patients?
So I feel like that's a It's kind of a tricky question. And a lot of times, because I have a keratograph, which we're going to go over, and it gives you a lot of objective data, right? So we see like the structure, we see the chemistry, we see, and I would say the hardest thing for me, even now, is to see somebody, because we survey patient. Let me just backtrack. So we come in, patients come in, they have a little paperwork, and we survey because it is really, really common. And the what's complicated is when they feel fine but they don't look so good. That's where I feel like the biggest challenge is. So if you tell me what's how many patients in my office have dry eye, I think I follow the national statistics, which I think is like 85%. Now, how many of those are actually symptomatic and willing to do something about it, or interested enough to do something about it? I'd say probably 20 to 30%, which is still, I think, pretty significant.
Terrific, terrific. That's really helpful. The and that is we brought it up in many episodes, but just like COVID, when COVID hit, the majority of dry eye patients are asymptomatic, and you nailed it on the head. That's the hardest. It's one of the biggest challenges for patient and doctor, is that when you're feeling fine, then you tend to not think you have to do anything about it. But then it's progressive, so you want to be able to be proactive and do the best you can to manage your eye health to ensure the highest quality of life you can forever. So that's a big part of what we're all learning here today too, and then have learned in the industry. So prevention
Yeah.
is a really big part of what ocular surface disease management is all about. With that, I'm going to go ahead and get started with some of you have two great success stories to share tonight. You want to share with us your patient number one,
Yeah.
kind of the background and
Yep, my patient number one. So I saw her soon after I've came into the office. So I've seen her for a couple years, and the first year she came in, we I didn't have, right. So it's 2019 actually, is I was here part time before I came full time. So I didn't have any of this equipment. And the biggest thing, that's not on the slide, but the biggest thing was to take her from like a 2 week or a monthly to a daily in terms of her contact lenses. That was like one of the big step. But then even the following year, she came back, and then she was still pretty uncomfortable, and then was using doxycycline for her rosacea on a regular basis. And I think at the time where she came, she couldn't reach the other doctor for her doxy. I ended up writing it for her. And then, of course, it makes her eyes feel better, but it's kind of chronic. And so on the exam of the 2020, when she came last year, by that time I had my 5M, and that's what I'm talking about here. DEQ is what we use to assess the symptoms of the patient, so how she feels. Anything, a score, anything 6 and above is symptomatic. So if you have 8 to 15, she's pretty uncomfortable most of the time. Then the slit lamp is what we use it's like our microscope, what we look to magnify the structures of the eye. So I always like to note if they have a thin tear film, that tells me there's not a whole lot of water. Cloudy mebum, that's when we press on the glands to see what kind of oil expresses. And then debris in the lashes, rosacea on her eyelid margin. I'm just gonna tell you, like, this is looking for telangiectasias on the lid margin. That if we look for that, most people have some kind of ocular rosacea. It always comes to whether they're symptomatic or not. So this lady was very symptomatic. Um, the NIGBUT at the 5M, that's how quickly her tear film breaks. So it's very unstable. And then interferometry. So these are all data that I get from this 5M keratograph. So that gives me an idea of the chemistry. Interferometry projects, like, it's like looking at the oil layer of the tear film, and what you would want to see is sort of like when you see oil over a puddle of water after rain, these nice colors, like a rainbow, a prismatic kind of thing. She had no color at all. And then the mebaraphy, which I think we're going to see, we're seeing that she has some of a, oh, there you go, that's great. So okay, so the top picture kind of shows you what she looks like. I didn't include the reference, but like an ideal patient would have these long thin piano keys. And she obviously has some distortion. Some of them are shortened. If I can backtrack just quickly, um, so when we think about chemistry of the tear film, the way I always explain it, there's three layers. Base is mucin, water's in the middle, and oil is on the outside to stabilize it. So if there's an issue in one of those three layers, then technically you have a dry eye patient, but then it's a lot more complicated than that. But that gives us a basis. So we saw like on the other picture, her nig butt, like this is the nig butt. So it kind of shows you she blinks and right away her tear film breaks up. So her oil layer is not stable enough to stabilize her tear film. That will cause blurred vision and being uncomfortable in your contacts and so on and so forth.
And that was for the audience's benefit. So the before and after that you're looking at tear breakup film, when you see red, that means it's completely dry. There's no moisture at all.
Correct. Like as soon as she blinks, boom, her tear film starts to evaporate, which that's when people say, and a lot of times when you pay attention and you do your exam, those patients like will have to blink as they're doing their exams because their eyes are just drying out and the image gets blurry. So blurred vision is another sign of dry eye. So yeah, so this is quick. This is improved. It's not ideal, but it's much, much better. So that was after, I think that's after our IPL. I would have to look at the dates, but yeah. So we see the improvement. And then the other thing, like why I like why I like her for many reasons, but this is kind of cool when, and I was telling you earlier, is it's a lot of faith, right? In your provider that they're doing the right things and we're working to kind of get you better. When you see the physical change in the glands, that we were pretty excited about that. So I'm sorry. Go.
I said, that's awesome. Yeah, I was just showing, I was going to put up the slide to show what you did in office to get them from before to after.
Yeah, I'm sorry. I get like kind of excited.
You're passionate about it. It shows.
So, okay. So the other reason why she's really near and dear to my heart is because she came in where I was looking at the IPL. I got an iLux first, which I don't know if people are familiar, but when you have that blockages in your meibomian glands and you try to get the oil and the flow going, you can express those glands and kind of get the old oil out and get them primed. But people with rosacea, a lot of time, because they have some gland loss, it just, and I learned that the hard way, it just doesn't work as well. So then I started looking into the IPL. Again, COVID gift, like having the time to talk to a lot of different providers. And I just thought, if I'm going to do this, I'm going to do it right. And that way I can offer from start to finish I can treat my patients the best of what's out there. So I called her and I think I emailed and I said, listen, this new technology I'm getting, it's like really targeted for rosacea patients. And she was so hesitant and, it's a little costly and it's an investment. And so and I'm telling her, like, based on the studies, I really think this is going to work. And I just remember her the first day, because you got to think like you're laying there, your eyes are closed, so you don't know all you hear is sound and somebody's coming close to your face. But she did amazing. Like she did great. And then she started to feel better, like after the first one right away. And then, was pretty good about her treatment. And then we emphasize always at home treatment. Like we say, okay, I can do this in the office, but if you don't do anything at home, it's one way. Like you need to help me maintain. So that's why I like the tea tree oil facial and lint cleanser. You got to keep things clean. You got to control the inflammation. You got to, help clean out the debris, get rid of all that oil that is stagnant, so on and so forth. So we gave her, at the time, I'm not sure if we packaged, like now we package, we have our omega-3s, we have our heat mask, we have our tea tree oil cleanser. So at the time, I think she might have left with it. Oh, no, you know what? You're right. She didn't want to take fish oil. So I had to look for a vegan supplement for her, but she was getting on board with doing the home maintenance. So this was August, and then we did September, October. So around November, she was a little discouraged, and was thinking like she was feeling great and then not, you know? And we had a conversation, and things just as silly as having the heater blow hot air in the car is going to mess my treatment up. So we had a conversation about how, you know, in your environment, like sleeping with the fan or having the heater, like that's going to make a big difference in our results. So just talking about, okay, if you're going to do that, make sure that you're super diligent about taking your, taking your supplements and doing your heat mask and doing your lid hygiene. And then we also had to tell her about we need to do one more IPL. Anyway, so she trusted us and we ended up doing 5, and it finally like clicked in, and now she's super happy. Like when we say went from a score of 15 to 0, that means that now she comes in, she wears her daily lenses, she can wear them longer, and she's overall a lot more comfortable and hasn't had to take her oral doxy for her rosacea, which was a huge one.
Fantastic. That's fantastic. We've heard a lot of people that it's there's mixed feelings about that too, for the GI issues, but also there's some other things that is not necessarily the best thing. I have rosacea, and I was able to get off of that doxycycline, and it's wonderful. It's just better for your body. That's a great one. Okay, I'm going to move us along because we're already 17 minutes.
I'm sorry. Okay.
Patient number 2. Patient number 2. Here we go.
So patient number 2 was also very challenging, but in a different way. So she came to me after she'd seen, I mean, she named a lot of people in the area. And then I always think, what am I going to do different? You know, and everything we would recommend, she had an answer, or she had tried, and then it's just like slowly with a lot of patience and kindness and trying to establish that bond that I'm on your team. Like, I'm not trying to make you do anything crazy. I just, want to get you better. And it's kind of the same thing. She actually, her presentation is a little bit, she was very symptomatic. No, when we press on the glands, no oil whatsoever. And then I think if you go to the next one, you're going to see, yeah. So her thing was her lids. Like, she had a lot of debris in her lids. She had this chronic chalazion. We were having a hard time. She had seen surgeons. She had seen just a lot of different people. And again, that was a thing where I was like, okay, listen, like, we really need to modify the environment where this is happening. And it was just challenging because I haven't been doing this for 10 years. I'm just sharing the knowledge and the experience I do have. And so I'm thinking, this is what we should do. And she would come back and say, well, I've tried this. And it's like, okay, can you just trust me? Like, let's stay the course, work together. We'll modify this. She had reactions a little bit to the tea trio. She couldn't do it twice a day. Anyway, we did this whole, it was pretty challenging, but again, with I think really patience on both sides, her with me, her and myself with her. We ended up getting a lot better. And her also, it took, if you want to go next, yep. It took so we debrided her lids. We were alternating between the tea tree oil and the hypochlorous acid. She had an issue. I mean, it was just a lot. Again, the IPL came through. And it was one of those where after we were done, she left us this unbelievable reviews, which was, it's a big testament to the bond we were able to create with her. And that's another one that's really dear to my heart, because it was a success story where she was doubting me, and I was just challenging my knowledge, but just text colleagues, and that's one thing I have to say. The dry eye doctors they're good people. Like, you can reach to anybody. They'll help you out. They want you to do well. They want the patients to do well. So with the help of a couple colleagues, am I on the right track? Am I doing the right thing? Yes. Reinforce with her. Just, again, patience, kindness, because a lot of times when people are frustrated, they have a hard time to trust.
Yeah.
So just, just little by little, and and respect for her frustration, and then we kind of broke through, and she's super happy. So
That's really
a
neat.
great one.
Yeah, what you brought up a great point, which is because the science is evolving so quickly, and it continues with the advancements and our knowledge and what we know relative to being able to improve the quality of life for dry eye patients, that there's a lot of camaraderie amongst the physicians that they're passionate about ocular surface disease, and the sharing of that information and the sharing of the knowledge, and that really is what this platform's about. So that's super. And I've seen in this that you're a big advocate for, and we've been speaking about the paradigm shift, that it's not just what you're doing in office, but it's what you marry that with at home too, that makes it all work. And to your point, you need to watch the environment and your lifestyle, whether it's diet, whether it's your blinking patterns, all these different things really contribute to the success of the outcome of your in-office and your home treatment regimens. So do you have all of your patients have an at-home regimen along with their in-office treatment?
Yeah. So that's actually what we do first. So this is the way we do things. And so we screen them when they first come in, and then look at their symptoms and look at their signs. And when I first started, I mean, like you see, I get all excited and I'm like, let me show you this. It's so cool, and this and that and the other. But sometimes when the patient feels well, they have zero interest. And so that's where I'm like, I would tell everybody, but then I'm not like, let's say Dr. Breimer, that's all she does is dry eye, right? I do a lot of other things. So I almost have to not pick and choose. I don't pick and choose. I do a brief summary and then say, is this something you're interested in? Do you follow what I'm saying? Do you understand? I tell blinking exercises, everybody, depending on the symptoms and the signs and their skin type, then I'll start them on home maintenance. Like, at least let's do this, and then bring them back in 6 weeks or so. Then we do a full extended keratograph. We review their home maintenance, and then sort of see where they are. The other thing that's interesting about the keratograph, it really helps you define, is this more of a water issue or is it more of an oil issue? And then that's been really neat to be able to target the treatment appropriately. And so at the 6 weeks, we do a more extended version of the keratograph, flip the lids, put more dye in, look at all the different things, their environment, their medications, and kind of do a big summary, and then decide from there, okay, do you just want to stay on home therapy, or should we go in forward with office procedures?
Got it. Okay, we have a couple different, what questions do you encourage patients to ask their dry eye doctors?
To know whether it is a dry eye doctor, or what should they ask? Like any.
So we actually have both questions. So let's start with, if you are your dry eye patient going to the dry eye doctor, what questions would you want to ask? I guess it's kind of the same. So because one is, how do you find, like, people want to know what questions should I be asking eye doctors to know if they're a good dry eye doctor, if they're a great dry eye doctor, if that's something that they're passionate about. Do you have any suggestions for the listeners out there of what some good questions would be?
So I think that the equipment makes a huge difference in how you can better diagnose your patient and then recommend treatment, right? But you can do a lot with a slit lamp. It's just, are they looking at your glands? Do they tell you about, oh, your tear film is thin? Like, do they even mention anything about, like the quality of your tear film? Do they look, again, pressing on the gland seems silly, pressing on the lids, but at least that's telling you the doctor is paying attention. So what question? I think I would just want to know, like, if they are symptomatic, what what diagnosis equipment are you using? What diagnostic equipment, and what treatment do you offer in your office if I have severe dry eye? I think that's a good question.
That's good advice. That's really good advice. And then you'd already mentioned there was another one about home treatment plans, which you also mentioned. When you're doing IPL, do you express the glands after your IPL?
It depends. So initially I did, but then what I came to realize is that And IPL is not really like, it doesn't heat the lid. You know, it would be a cold expression to do. So I like to look. I debride, you know, I press. And then if I have, but I don't do like a forced expression. I just like to look and see what's happening, you know. And then we combine after the fourth IPL, we'll use our eye lux and then really like express them, because now we have better oil in theory. If everybody's doing what they're supposed to, we have much better oil. Express them with the iLux, and then just kind of go from there. And then the way I do it is when I package it, I include the 6 months. So you get 5 treatments, because I don't want them to fall off the wagon. And then like I find an extra little hand holding, you know, at my 6 months from the beginning of my treatment is very helpful, keeps them engaged and just tied to the office and understand how the follow-up is important.
Wonderful. Okay, great. Yeah, we've also heard that a lot of the practices will they'll do the IPL, and they'll warm up the lids, like you said, either with IPL, you could do it with a device or a compress, and then express, because cold expression can be uncomfortable. We had a question about how do you apply the hypochlorous the hypochlorous spray? How do you suggest doing that?
The instructions all say you either close your eyes and just spray it and then wipe it, or you can spray it on one of those round cotton, yeah, and then go ahead and use it. I use more tea tree oil than I use a lot of the gentle lid cleanser. That's what I start people on, or anti-age if it's, you know, if it's appropriate for the patient. But that's kind of my favorite, and I've had a lot of good success with it. And then if I have, you know, we've had a couple incidents where they had an allergy or something wasn't right, then I use the hypochlorous spray.
Okay, very good. And then we have one more question. You kind of explained it already, but it sounds like when people come to Envision Ghent, which is the name of your practice, that you're screening everybody. You're screening all patients?
Yeah, I am.
That's great. And so the DEQ5, for those out there, we mentioned it earlier, that stands for Dry Eye Questionnaire, and it's a version 5, and that's symptoms. So it's like how you're feeling about it. And then the signs, as Dr. Cassis has so well described, those are going to be diagnosed through the slit lamp, through the keratograph 5, which is a topography, but also does meibography and some other instruments. And then from there, she's able to really form a recipe for success for you individually. And that could be anything from being able to start, like you said, just with your home treatment. Let's see how it goes. And maybe this will get things back on track for you. And if that doesn't work, then here are some options that you have available, which could be lid debridement if you have issues with your lids having lots of gunk on them, with either Demodex or blepharitis. And then the IPL certainly helps with the rosacea, but also then some. And manual or mechanical expression of the gland. So it sounds like you have the full gamut there.
Yeah.
That's wonderful. Well, I just can't thank you for everything that you do. I think that people are really happy that COVID, nobody's happy COVID hit, but you made the best. You turned lemonade, made lemonade out of lemons. Yeah. And we're seeing that over and over again. And I'm excited that you came and joined us tonight. I really appreciate you bringing these stories with you, and for the audience out there, hopefully you picked up a couple pearls tonight. And if you live in the area, please go see Dr. Cassis.
Thank you so much.
Yeah, my pleasure. And we're going to continue this. We have another episode coming up. I have a slide here with, oops, there we go. With the information for Dr. Cassis if you want to reach out to her. And of course, this will be posted up on the YouTube channel. We have another episode coming next Thursday. I won't be here because but Marcus, who is our sales and marketing director, is going to be hosting that one. It's my 15-year wedding anniversary.
Yay!
I'm going to be with my husband. So
congratulations.
I hope everybody else can join us. It's going to be a wonderful episode, and we're going to take everybody to New York. And so if you're on the East Coast in New York, upper East Coast, you'll meet another dynamite, great dry eye doctor. So with that, I thank everybody for joining us. I hope you all have a wonderful evening. And again, thank you, Dr. Cassis, so much for everything you're doing for dry eye patients and for spending some time with us tonight.
Thank you so much.
You take care.
Bye.